Myself, Dr. Rakesh Kumar Jain, physician from district Mandsaur. We are talking about esophageal stricture, how to spot them and find relief. An esophageal stricture is when the esophagus, the tube which carries food from our mouth to our stomach, becomes narrow. This can make it harder for food to pass through. The most common cause of esophageal stricture is long-term GERD, where stomach acid irritates the esophagus, leading to swelling as well as narrowing and scarring over time. Other injuries to the esophagus and scarring can also cause esophageal stricture. Some allergies, radiation therapy, swallowing harmful substance, surgeries, cancer, and certain rare skin disease can also cause esophageal stricture. Some people may also be born with stricture. In rare case, pressure from the outside on the esophagus can cause it to narrow. The main symptoms of an esophageal stricture is difficulty swallowing, known as dysphagia. You might feel as if the food is sticking or passing slowly through your throat, chest, or upper abdomen. You may or may not experience the symptoms of esophageal stricture. When symptoms are present, they usually get worse as the narrowing of the esophagus increases. At first, swallowing following food or pills may be tough, or over time, symptoms of esophageal stricture are heartburn, regurgitation, or food traveling back into the throat or mouth, pain while swallowing, and weight loss. Esophageal disorders are usually diagnosed by a gastrologist who can understand your symptoms and medical history, and then use one of the common tests to check for stricture. The first test is called the esophagogram or barium swallow test. In the test, you may have to swallow a chalky substance called an barium, and an X-ray machine takes a live video. The second test is an upper GI endoscopy, where you are sedated and the doctor passes a thin tube with a tiny camera down from throat to the see the inside of the esophagus. They can also take a small tissue sample if needed for further diagnosis during the test. That is FNAC. Treating an esophageal stricture may also aim at widening the opening to you can also swallow food easily. A procedure called esophageal dilatation is effective in achieving this goal and involves stretching the esophagus with a swallowing or gradually make it the opening wider. But dilatation is usually successful for simple stricture which are small, have right edges and still to swallow it. Dilatation is done as the outpatient procedure, typically once a week for severe weeks until your esophagus reaches the desired width. Each session will gradually widen the stricture, while many structure improve with a few sessions. Some complex structure may also respond well or can return later. In such cases, other treatment may be necessary. For esophageal stricture that can do respond to dilatation alone, for doctor, you may use a combination of treatment. Cancer structure may need a different way of different way. Main focus first to treat the cancer. Doctors may also use steroid injection at the structure to site to reduce the swelling and prevent it from happening again after dilatation. Endoscopic stricturopathy is also procedure during a special needle need to break up the scar while issuing your stricture. Your doctor may also have cuts through endoscope and the may need a stent is also a small tube placed in the esophagus to keep it open for after dilatation. The procedure also called for cancerous stricture that have may not be treated with dilatation. Some cases surgery to remove part of the esophagus may be necessary, especially for the cancerous stricture or those who do not respond to the treatment. If you have chronic acid reflex measures, minor surgery can be recommended for doctor to prevent further reflex. Esophageal stricture can also be prevented in some cases if you experience symptoms of narrowing of food pipe or chronic acid reflux such as heartburn or chest pain. It is important that you have see your doctor immediately. These symptoms are not just bothersome, but they point out that real damage that can be occurring inside. Fortunately, they have usually treatable once your doctor identify the cause at the right time. So do not hesitate to reach out to your doctor for assessment and treatment. Thank you for listening.